Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome to another episode. We have Dr. Claire Plumbly with us. I'm so excited for this conversation. Welcome.
Thank you.
Now, tell us a bit about you.
So, I'm a clinical psychologist and I'm based in the UK. You can probably hear from my accent in Somerset, which is southwest of UK. I work in private practice, but I began my career in the NHS. And yeah, I run an associate practice of other psychologists, clinical and counselling psychologists. We're all trained in therapies that you might know of: CBT, cognitive behavior therapy, compassionate mind therapy, ACT, mindfulness, EMDR, and we can apply this to all sorts of difficulties, but we tend to have a bit of a focus on burnout, anxiety, and trauma. And yeah, my most recent project that I'm very proud of is that I've written a book, and I'm going to just hold it up here for anyone looking. There are two titles, but the title that anyone in the US and Australia might be familiar with is The Trauma of Burnout. And that brings a clinician with trauma training lens to this topic of burnout, very much focused on helping people understand their nervous system. And in fact, the tagline is how to manage your nervous system before it manages you. So yeah, it was an opportunity for me to bring everything I give to my clinical caseload, my clients, and share it with people who might struggle to be compassionate with themselves, struggle to slow down and not understand why. And I thought if they understand their nervous systems, they will understand why. And that's often the missing piece I find for people. So yeah, that's my recent projects, and I've been enjoying kind of sharing that with people and yeah, like offering therapy off the back of that when people have read the book and then thought, I want to go a bit deeper.
Love that. That sounds amazing. We'll dive into all of your wisdom in a moment. Tell us about what got you into clinical psychology and part of the journey of that as a career.
Oh, yeah. I was the year group in Britain. We do A levels when psychology began to be offered on the curriculum as an A level, which was quite exciting, a bit mysterious and magical, really. The idea that we could start understanding how humans tick from taking this course. And so I did the A level and enjoyed that, and then thought, well, okay, might carry on to university, and I carried on. And when I got to the end of that, I realized that actually I might enjoy doing it as a career. And it felt like an attractive career because it tied in with just the family values growing up. My mum was a children's nurse, often in a kind of giving profession, but I still quite liked the idea that I had this extra kind of magic power that I could understand humans and how they tick. And I was always the one in my family who was the communicator, who was the negotiator. So I think I just saw myself as having good people skills. And yeah, so it's quite a simple journey in. But yeah, here I am as a clinical psychologist. And like I say, in the NHS, they train you up. So most psychologists in the UK begin their journey in the NHS. And lots of them stay in the NHS because it's a great career path. But I veered off when when we moved from London to Somerset and started my own practice. Yeah.
Okay. Tell us some of the challenges or things you didn't expect as you moved into clinical work about having clinical psychology as a career.
What things didn't I expect? I think that there isn't a right answer. And I'm sure that's across the board in it with any clinician. You learn all the theories, you see all the research and the data, and it all looks like hard facts. And then you get in the room, and often it's not like that at all. There's so much grey. A lot of it is trying to marry up the theories and the ideas with your clinical experience as well, which is hard early on when you don't have anything, and being okay with not always knowing that it's a little bit of working with the person in the room to see how might these ideas fit, and being okay with making sure you're connecting with your colleagues and bringing case studies and learning. Yeah, I think that's one of the surprises. And then just learning how much of human distress often comes down to there's how systemic it is, which I don't think is always reflected in a lot of mental health diagnoses, for example, but also how important those early life first years are, and those attachment wounds where our attachment figures might not have been there in the way that we needed, can follow us into adulthood and can impact on things like burnout, because often we're still seeking and looking for those needs to be met. And if we don't have that good relationship with ourselves, that can impact on us seeking it in other ways, perhaps from overworking or trying to seek approval from others by really applying ourselves and achieving and overdoing it.
Interesting. Tell us about looking after you within that early years of the career. Was there the expectation that you guys would have your own psychologist, or did you meet to, as you met and discussed cases, was that also part of looking after you about these humans in distress that you're hearing their stories of? Because we don't seem to have a lot
Mm,
of that in medicine where we're doing that debriefing or how are you feeling as you're
yeah.
learning about these humans who are having such significant illness or distress mentally. Was it better from a clinical psychologist perspective? Were you guys doing that better than us?
Yeah, during training, yes, you didn't absolutely have to do therapy, but there was definitely like a suggestion that you should and would benefit. And we would have a group therapeutic session as a cohort during our training, which was, yeah, experiential. And I do think it really does help to be on the other side of the chair of the role you're going to be in, because you really do get how important not filling all the gaps are, the creating space and what it's like to be asked difficult questions. You don't need to rush in and try and save the person. Actually, there's a lot going on in that moment. So I think there's that perspective. But like you say, we're very lucky as a profession because it's built in and as an expectation to stay accredited with our governing body. We have to have regular clinical supervision. And I think I get two lots. I get one from one form of therapy, another from another form of therapy. So you have to have, I think, at least 1 hour a month. And when I was in the NHS, we had peer supervision. That was really lovely until cuts started to come in. That was part of my burnout experience in the NHS when cuts came in, and those things were seen as nice to have, so rather than essential. But peer supervision is great because sometimes you've got lots of people in the room all sharing what's going on for them, and you learn so much rather than the one-to-one more hierarchical relationship, which is also really helpful. You're learning from someone more experienced and bringing your cases, talking about how they might impact on you. And if you've got a supervisor that's in like minded and trained in this way, they're thinking about why did you ask that question in that way, what was going on for you. It's really powerful for you as a therapist, and it really helps you with your journey. And I'm always horrified, and I do write this in my book, the number of professions that are holding deep, difficult stuff, and there's no thought about that at all. One example is someone who's just working in like the financial ombudsman. Do you have ombudsman in yeah,
Yeah.
and talking to clients on the phone who are losing their home, and she would have to talk to them about this really difficult, or if that's one of the worst things that could happen to someone, isn't it, losing their home, getting
Yeah.
off the call and then having to go and make another call of a similar kind with no thought about what impact that is like for someone. So there's loads of jobs like that. And doctors, I think, yeah, it's a real shame that's not on offer. But there are places where you can get it. So, for example, here in the UK, I was working with someone recently, a psychiatrist, and we were talking in therapy. She was saying, I can just see how much I could benefit from that kind of supervision that you refer to. And actually, the Association of Clinical Psychology over here do have an offering. So it's worthwhile, if anyone's listening to this, just checking if the Board of Psychology of your country have anything like that for MDT,
Mm.
or seek it out from a psychologist. I'm sure lots of psychologists would happily offer that in, because that's our part of our private practice is to do supervision and therapy.
It's so fascinating because we have the supervision model for our junior colleagues. But when we ask, why did you ask that question? It was all about that clinical reasoning and coming up with our assessment and plan. And it's rarely, though it happens, it's rarely that, how are you doing in this
Mm,
encounter? That's such a fascinating swing on it and making me more mindful to ensure my junior colleagues are also being asked those questions. And
right.
ensuring I have the skill set to actually be able to ask that question of our junior colleagues.
Mm,
But it's so valuable to have that from the onset and to have it normalized as part of your career. I think
mm.
great benefit to learn from that.
Yes, wouldn't it be great if anyone listening to this has the power to make some changes and we could start rolling that out, yeah, in training earlier on.
Yeah. All right. Tell us about why burnout, why trauma? Where did that little gem come from? Why is this the focus of your book? What's the background of where this book came from?
Yeah, so when I started my career working in the NHS, I did some early kind of trauma work then. And a lot of what we see actually does stem back to something that's gone on. Even if someone's presenting with something like a health anxiety, quite often when you peel back the layers and go back, there'll be something that's happened early on, a family member who was ill or someone, who was very fastidious about health checks and stuff. And you can see the traumas have built up. So I began to get that picture anyway in my career. And then I started a job in a sexual assault referral centre and did some extra training in a model called EMDR, which is eye movement desensitization and reprocessing. And so I started to go much deeper with the trauma models from that. So I trained in that in 2016 and I just really liked it. And I really liked the network. It's actually EMDR training isn't just available to clinical psychologists, available to other modalities of therapy, psychotherapists, and sometimes the therapeutic social workers and things like this. So actually, I started to broaden out who I was speaking to, not just clinical psychology, which was actually really interesting because they use different models. But yeah, my psychoeducation, which is the part of therapy when you're teaching people to understand what's going on, like how bodies and humans respond to difficult events so that they can understand what they're going through as a normal reaction to an abnormal set of events. I just found that really powerful and realized I was using it for clients who are coming in with a burnout presentation. So here in Somerset, where I work, I'm very near a hospital. So, of course, we're going to get lots of people who experience vicarious trauma and trauma because it's heavy work and burnout. That's a group of people who don't get much airtime, I don't think, and they don't get supervision. And what they're holding is really hard because they've got the distressed animal and distressed humans, sometimes who don't have insurance. So they're another group there's quite a lot of locally, and other groups too, teachers, for example, and self-employed people. And I just was attracted, like burnout became more of a word that was being used by people. So I just began to research it and research what was available in the literature. And I found a really helpful book called Burnout Solve the Stress Cycle. I don't know if you've heard of that, but it's aimed at women. So I found it really helpful. And then my husband started to struggle. And I was like, oh, read this book. And I gave it to him. And he was like, this book's for women. And he just could not get into it. So I was like, oh, maybe I need to write you a book. So that's why I started writing my book. And yeah, like I said, I wanted it to be because what was available on the market for books had been written by coaches or research psychologists, but not from a practicing clinician that I could see at the time. I still don't think there is. So it takes you through the assessment phase and then that psychoeducation, like I said, about the nervous system, and then a model to apply to overcome it, and then how to prevent it. And I talk about post-burnout growth, which is a term that I borrowed from post-traumatic growth, which is how once you feel like you've gone through the worst, you can start to build up again, because sometimes you can let go of some of those sunk costs that we couldn't see that we could do before the worst happened. And it's appropriate for anyone who is in functional burnout, that kind of still pushing through, still doing all the things, as well as people who've slipped into more clinical burnout and shut down, maybe you're off work.
Yeah, got it. All right. So locally, you're seeing a lot of burnout. Even in the home, you're seeing burnout. You've
Mm,
experienced burnout. Tell us, what are some of the signs that people would notice that would help them understand that they could be starting to experience burnout or that
mm.
they should be paying attention to?
Yeah, so I like to break it down into the four areas of your body. Your body will probably be screaming at you. It starts off whispering and then it gets louder. And quite often I have people in the therapy room, their body is clearly screaming at them, they still can't see it. So what are the physical sensations, aches, pains, quite often in the large skeletal muscle groups? I'm pointing to my neck, my shoulders, headaches, tensions. People say, oh, my IBS keeps flaring up, or my eczema. These are all stress reactions. For me, I'll often get loads of cold sores. So that's a bit of a red flag for me. Like, oh, I've got another cold sore. And yeah, you'll take ages to recover from illnesses. So the body. And then the second one would be cognitively what's going on for you. So quite often our thoughts become very rigid and very focused on getting through. To
Mm.
the point that we think, I just get through this bit, just get through this bit. At the same time, you're getting escapism thoughts like, I wish I could just break a leg or something. Nobody would expect anything of me. I wish I could just have a quiet few weeks in hospital. And then, so there's escapism thoughts, not necessarily the nice type, but also cognitively, there's that kind of doing, you're going so fast that you're dropping balls and you're getting muddled. So I remember literally I was washing up and putting my mobile phone out of the washing up bowl. I got so muddled, I'd washed my mobile phone. So just doing things, making mistakes, feeling that decision fatigue is just really hard. And also initiating things, like if transitioning from things, you get so stuck on doing one thing, like initiating the next thing is hard because you're stuck in one gear. And anxiety and worry thoughts, all depressed thoughts, cynical thoughts, those are all the cognitions. The third area would be your emotions. So obviously the definition of burnout talks about physical and emotional exhaustion. I think emotional exhaustion sounds like a bit of a strange idea for people. So how I describe it is, ideally, we would have a full repertoire of emotions, from feeling content and happy to feeling passionate, excited, as well as the negative ones. But in burnout, quite often, we're just stuck with the negative ones. We're oscillating between worried and overwhelmed and anxious, and low and flat, but we're not getting access to those other ones. And so, yeah, for me, I was just constantly overwhelmed and thinking I was rubbish at what I was doing. I'm a rubbish mum, I'm a rubbish therapist. So putting myself down. And then the fourth are behaviors. So usually I do this one last because you're doing something to cope with all the pain of those other three, something that can numb us from the moment quite often. So that's where we start drinking that extra glass of wine at night, because it helps to turn the brain off, the constant chatter, the to-dos. Or for a lot of people will end up with an Amazon basket that's going through the roof, spending a lot of money that things that they don't really need, or just doom scrolling. My sign was that I kept buying courses I didn't need. So this married up with the escapism thoughts. If I could just like weigh out, and then it's like the algorithm, the Facebook algorithm spotted what I was doing and just kept on sending me ads of like, do this course, this will make your life better. And I was like buying things I didn't ever watch. Yeah, so I think some of those are some examples of signs, and some of my personal signs when I was in that functional burnout.
Yeah, that's really helpful. I think that when we ask people to think about how they're feeling at work, to show that you may only have two or three emotions that you can even notice about.
Mm,
I don't think I've heard it explained that way before, and that's fascinating that you might just discover I'm overwhelmed, I don't care, I'm feeling flat or tired, like those like really undescriptive range of emotions
yeah,
rather than I'm content, I'm happy, I'm fulfilled, all those
yeah. The
flowery words.
nicer ones, yeah, the good ones. But the thing is, how I explain it to my clients is that when I talk about the nervous system to my clients, and in the book, I talk about the three branches of the autonomic nervous system. Do we have a moment? Can I share that?
Yes, please do. Yes.
So just before I like launch into that, to just say about the autonomic nervous system, in case anyone's listening and doesn't fully understand what I mean by that, it's the part of the body that's responsible for keeping us safe. So it's always on and always scanning the environment for signs of threat. And it does at a pre-conscious level. So from our environment and from faces and the people around us, it's picking up cues. And so if there's any whiff of something not being okay, it will spark a reaction that happens inside us. And so it does that because the brain and the body organs are talking to each other all the time. They're sending messages up and down the system. And what's helpful to know is that 80% of the direction the messages go from the organs to the brain rather than the brain. So 20% go brain to organs. And why I'm highlighting that is because I think sometimes people struggle to understand why some of the cognitive strategies they might have up their sleeve aren't working, which might be affirmations or journaling or problem solving, like really useful skills. And I'm not knocking them, but if you're not in the right part of your nervous system at that time, they're not the entry point. And so if your body's picking up signs of threat, which will happen, which is what's happened in burnout because you've been under constant threat, you go from being in your green rest and digest kind of mode, which is that where the happy, calm emotions are accessible. You spend a lot of time in your amber sympathetic nervous system, which is sixth gear. If you were in a car, it's like fast mode. All the energy, all the adrenaline is pumping. And so we get that itchiness. We find it really hard to slow down. We don't feel safe enough to slow down and rest. And therefore, that's why it's hard to switch off and go to sleep and to take a break, have a coffee break. So we're in amber a lot of the time. And in the animal kingdom, if you ever see an animal kind of racing away from a predator in amber sympathetic, if there's no possibility that they can outrun the predator, they will do the last best thing it can do to prevent it being eaten. It will go into the third part of its nervous system, will flop into dorsal shutdown. And so this is the part of the parasympathetic part of the nervous system called dorsal. And so we'll just stop breathing, which seems like a strange safety strategy, just immobilize and stay still. But it is effective because the predator will just think, oh, this doesn't seem appetizing anymore. I'm gonna go find a juicy morsel somewhere else. So humans might not collapse, although they might in clinical burnout. But in that functional burnout, what that collapse can look like is that we are just on autopilot. So we're disconnected. You're going through the motions, you're using procedural memory, which means that all the memory of habits, which is stored in a different part of our brain, we can still do that without having to think too much. Up until there's a problem. So that means you're driving home on autopilot, there's a blockage, and you can't possibly think of how you're going to get home now. And it can look like functional freeze. It is functional freeze, which can be also fawning. So just like going people pleasing, yes, sir, no, sir, all of that stuff, which kind of just people pleasing. It's a very unpleasant place. And so a sign you're in that is that maybe you're not taking on new information very easily. So, if someone says, were you listening? Or you can't remember someone's name, or new procedure at work. If you're spending a lot of time in dorsal and amber, these are not fun places, and we're not designed for that. We're designed to come back to the green, rest and digest. And if you're not, that spells trouble for you in the long term, physically, health wise, as well as emotional health wise.
Yeah. Okay, that makes a lot of sense because we hear a lot of physicians, for instance, just saying, yeah, I can't do that journaling thing, or
Yes.
that is just not working for me. I don't know how people think this is helpful at all. It is just simply not going to work for me. And so I'm super pleased you explained why that can be, because if we're in this really heightened emotional state, then using our brain to help calm our body down in those types of techniques is not the right time. All right. So I guess we're going to need to know a little bit
What?
about
What do we do then?
oh, now what?
Like when I do training on this, I have a slide that says, if you're amber, how do you get to green? If you're red, how do you get to green? So let's start with amber. Think of amber as a place where there's lots of energy pumping around your system. So there's excess. So you have to discharge it. So movement. There's lots of ways you can do it, but I talk to my clients about using movement until you feel pleasantly tired. So deliberately choosing to move your body, running up and down the stairs. You could do something if you cross the midline, which I do in my EMDR therapy through tapping, but you can do that with a bit more energy. So if you look up cross crawl, it's also in my book, there's some images. You basically move your hands to touch your knee and just, you look a bit daft doing it. But if there's no one around and you're at home, you can maybe do that. Shaking your body. You see in the animal kingdom, when they come out of dorsal shutdown, they do a big shake. We don't tend to think of ourselves as being people who shake, but shaking, humming, singing, things like this. Sorry.
I've seen colleagues jumping on the spot in the emergency department, and I always wondered what that was about.
I think we naturally do it sometimes. So we pace, don't we, when we're anxious? And what do we do? Like there's a lot of movement in our body. So just go with that. Your body knows what to do. So don't shut that down. Don't try and sit it out and keep going. I think we misinterpret that as an urgency, as I just need to get through the to-do list and then I can do all of this. But actually, there's not going to be an end of to-do list. We know that really, because who's ever got to the end of a to-do list? Because the problem is there's too quick a feedback loop now, because we send an email and they reply. So there's always something going back on the to-do list. So don't try and wait to get to the end of the to-do list. You've got to work out when a sensible stopping point is for your energy flows, and then you've got to just going to discharge, and then have a closing down routine. If you're working from home, change out of your clothes, close your computer down. I know that's quite hard, isn't it? I find that hard. Have a closing down routine. Practice it. It takes 3 weeks minimum to get into a routine, to put it into procedural memory. That's your best bet, is getting stuff into procedural memory. So it's something you start to do without having to overthink it and use your frontal lobes, which is which is hard work for us. So yeah, so that's that. And then amber, sorry, that's amber. Red to green. Should I mention that?
Yes, please.
Yeah, so that's more of a shutdown. So think of yourself like an ice block, and you need to start to gently thaw out. So you might need gentle movement. So right now I've got my hands up on my heart because I tend to find that really helpful. If you think about the touch points where the soothing part of your nervous system, the ventral vagal nerve kind of touches, there's a lot around your face, your head, so up on your forehead and the back. And when you just hold these points, any combination of those can be quite soothing and supportive. Self hug, listening to, if you find you get this a lot, creating some voice notes of people who you know care about you, who can just, it doesn't need to be soppy. It can just be something like, you're doing your best and I'm going to be waiting for you when you get home, or I love you, or just something like that. So what we're doing there is tapping into our attachment chemistry. And that we know releases oxytocin, which is an antidote to this stress stuff. It starts to release it. Attachment chemistry, if that's possible, gentle, soothing touch.
Okay, they are fascinating, and I haven't heard of those as much before, and I really like them. So that's when you feel like you're really struggling with the shutdown mode. That's right. So you
Yes,
don't have the energy, but you're in that plodding, maybe thinking
yes,
through,
everything feels
hard
heavy
to
and
be
difficult.
hard to concentrate on what's in front
Yeah,
of you, hard to change tasks, hard to get started. So I can totally appreciate this because we see physicians who've just finished their last patient and then they have that exhale. And then they sit
mm,
in front of what they need to do before they can go home
yeah,
and they just sit and look at it.
yeah, that's so hard. And like so I have my big heavy day of client work on a Tuesday, and I see 5 or 6 clients, and they've all got quite severe trauma. And so sometimes I'm hearing difficult things, and I get into that place to a certain degree. And so I've got a few, again, I give examples of affirmations in the book. So I'm doing my best. This is really hard. I do a
Mhm.
hard job and I am doing my best. It's okay that I don't know the answers right now. I'm just being there for them. And I slow my pace down. I have these affirmations, but use the embodiment of them through touch. That's the
Mhm.
missing piece with affirmations I often see shared on social media. Like the words aren't enough, it's the tone, how you're saying it, and it's embodying it physically in some way. And you can do the opposite if you need to bring energy up afterwards. If you then need to go into the next thing, you need to bring energy back online. Maybe you could jump up a bit and say, I've got this mini pep talk number 2 that might follow on. But yeah, embodied affirmations are really valuable for me.
I'm just thinking out loud if we then at that moment used some of your
Voice notes.
voice notes or a quick phone call to our support person or
Yeah,
something that could help us shift.
yeah,
These sorts of things could be a practical way to move from that one task to
yeah,
the next, especially when
yeah.
it's a task that we find the least valuable, if that makes sense.
That
We hate doing it, and we feel like it's like the cursed second job that we don't get paid for. Like it's
yeah, yeah,
the volunteer administrative burden that's just
yeah.
soul sucking and destroying our job satisfaction. There's no human to talk to about this. This is just the slog of things tasks that need to
Mm,
get out of our life so we can get home and get on with it.
mm,
Even the shift to you're busy maybe getting the kids ready for bed and then the kids are in bed and now you just got nothing left to
yeah.
go and clean the kitchen or get yourself to bed. I see that a lot where you're doing for them and then you just sit in a lump and be like, I can't do me now. I've got nothing left.
That's hard. I know. And I think if anyone's listening to this and really resonating with that, I think reflecting on when those hard points of the day are and what you need in that moment, it might be hard to do it in the moment. So I think when you're in a calmer, feeling more resourced place, think through that is the time I find it really hard. Maybe I need to record myself a voice note that says something like that. Like I, I always start my voice notes if I'm recording them for my own clients, I always start with, Sarah, you're listening to this because you're feeling really heavy and overwhelmed because you've just done all the stuff for your family. You just put all the kids to bed and now you're feeling exhausted. You're doing so well, and I see you. And we're going to get you to bed at a good time tonight. So you're going to go in and do the bare minimum for the kitchen so that it's okay for you to rest and go to bed. So I always start my voice notes like that, and you could totally do that for yourself. I think it helps to start it off and like, you've turned this on because you're feeling overwhelmed, you're tired.
Yeah, that is so valuable. I certainly know when I've worked with coaches in different areas, the guided relaxation becomes that familiar voice, and
Mm,
it became a really useful tool to use the same little voice clip that she sent me, the same guided
mm,
relaxation, because it wasn't just necessarily the actual physical work of doing a guided relaxation. It was this person wasn't annoying me. I was familiar with what they were going to say. Their voice became a useful, calming, additional
yeah.
piece to the actual work I was doing. And that was that sleep improvement piece that I was doing at the time.
Mm.
And I'm like, I see how this is so valuable. Yeah, fantastic.
Yeah,
Thank you.
familiar and routine is in there,
Mm,
isn't there? Yeah, which is what we
mm.
crave.
Yeah,
Mm,
yeah, fantastic. Okay, I think this has given us some really practical tools on one, noticing what's going on with our body, understanding why it's because it's so confusing when it's happening to you. And I don't know about you, but we see burnout's not just a one and done. It's like you get if
mm,
you get good at noticing it in your body, like you said, I notice when it's coming on again because, and you've got those physical manifestations. I think it's important that we show that burnout
mm,
comes back for lots of different reasons. Maybe there's lots of life happening or lots of work happening or colleagues are away or we've lost colleagues. We're having a shift in department, people leave, new
mm.
people coming in. There's lots of reasons why we can hit burnout.
I think any the fact that someone's listening to this is really valuable because they care about themselves. So there's that caring, compassionate part. So just a way to build on that is just to take 5 minutes just to think, even if it's just break it down to what does my body do? What's the cognitions? What are the emotions? What are the behavioral signs for me? And then I
Mm,
can recognize them when they start to creep in.
yeah, yeah. Is there a is there a prevention? Is it the early recognition, or are there other things that we could start to put in place that would help us prevent the burnout in the first place so we're not constantly cycling through burnout?
It is really hard because we're in a culture that where hero culture is celebrated. I think getting a compassionate accountability partner, somebody who gets what it means if you were to text them and say, I said no, that they're not like, huh? Why are you celebrating that? They get it. They can go, that's really good because they know you put a boundary in there and then you bought some time back for yourself. So who might that be? Who's on the same journey as you? Who wants to make the same commitments to themselves? And along the same lines, like compassionate decision making. So making decisions based on what you will help you get to the end of the day feeling not totally rang out. Quite often, if you get an inquiry, not inquiry, but like an email in or something, a request, a lot of people just look at their calendar and go, how can I fit this in? So if you shift the question rather from that, when can I fit this in a way that is aligned with what I'm working on right now? Maybe it is next week. Maybe I do need to, maybe they need to wait. That's really hard for us because we've got such an instant culture of response. But if you think about the people in your life who do that, how much respect you feel for them, it's quite a powerful strategy. Those are some ideas. And I also just mentioned to all my clients, like any transition points in your day, that's the invitation to pause and just do that mini check-in. What does my body need? What gear am I in? And so do a mini discharge, do a mini hands-on heart or whatever it is that you need in that moment. There's a moment there, might not feel like a pause, but there is. And we finish this call, for example, where you can pause and go, okay, what's in my body after that conversation with someone? So yeah, trying to just create a tiny bit more in that pause for you.
Yeah. Okay. This is really helpful. Thank you. I think that it helps us to identify that we're important too in the day, that we can check in with ourselves. We don't have to leave it to the end of the day. And we get potentially lots of transition points if we're seeing lots and lots of patients through the
Yeah,
day. We've
yeah.
got lots of opportunities from one task to the next task to
Mm,
just do that, looking after you too, which is really helpful for sustainability
mm.
and prevention of burnout. Anything we haven't talked about that we should talk about?
What I just wanted to say was winding down at the end of the day will be easier if you have managed to do all of that. Because I
That's a
think sleep is a really difficult one for a lot of people. There is a misconception that we will be able to sleep and switch off just because we're tired enough. But of course, that's not how the nervous system works. Because if our ancestors had been out on the hunt and they'd gone, oh, I'm a bit tired, they just lay down, they would have been left behind by the tribe and they would have been eaten, all sorts. So we have that ability to delay rest, even if we feel tired, until we feel safe enough. So, what do I need to do to get to bedtime feeling safe enough? And that is thinking about the whole build up of the day, but also thinking about having a very clear bedtime routine. A lot of my clients don't have that. One of the most important interventions, super simple, that I do with everybody is make sure they're not taking their phone into their room. They're buying themselves an alarm clock, because you might think it's not bothering you, but actually all the research disagrees that the fact that it could ping at any moment. And I know that's really hard for some people because they've got elderly parents and they need a phone, but just try to find a way, get a landline, get a phone in a different room. It doesn't need to be by your bed. But yeah, so then your physiology can start to come down the gears, and it needs to do that early enough to be able to then sleep. You can't crash from sixth gear. You know, I'm on a call quite late with you because I'm in the UK. So I know I'm going to have to go and do something afterwards. I can't just climb into bed because otherwise I'll be lying in bed for ages, ticking over. Oh, I should have said that different. Or what did she think of this? So I need somewhere for that to be released.
Yeah. Okay, that's really valuable. I totally hear what you're saying because the number of times we go to bed and we're like, I'm so tired. I'm like, and my body doesn't think so. My brain
Yeah,
doesn't. Well, my brain
yeah.
just won't let me sleep. I can't believe how exhausted I am, and I still can't get to sleep. Yeah, that's really helpful. Okay, Claire, where can people find you if they're looking to learn more and buy your book?
Oh, thank you. Yeah, so my book's available online. Like I said, The Trauma of Burnout. And in the UK, it's called Burnout, How to Manage Your Nervous System Before It Manages You. I've got a website, drclaireplumley.com, and you can come and find me there for speaking, for therapy. And something your listeners might find helpful to know is that I also offer, along with my associates, something intensive packages. So if they find the idea of carving a weekly session of therapy out too tricky, they can do it intensively for say a week, where we go deep and we look at we haven't even covered this actually, we look at all the internal stresses and pressures that we put on ourselves, like perfectionism, people pleasing, and we cover one of those and we go deep. We're trying to make changes so that you can break free of that tendency. And I'm on social media. I'm on Instagram, LinkedIn, Facebook. I am on TikTok, but I don't use it very much. So all the social medias, and you can also listen to my book if you prefer audio methods. Audiobook is available.
I love that. And I love the idea of an intensive therapy.
Mm,
That's really fascinating because I think that would suit a lot of us. I hear a lot of that escapism is I'm just looking for a retreat. I'm just looking for somewhere I can go and then
mm,
just discharge this and come back a better human, like in 3 days' time. And so we're like,
yeah,
that's how burnout works,
I
but
know. It's tempting, is it? But if you do some of the deep work, you might be able to get closer to that.
exactly, that's what I'm thinking. It's not just the sitting quietly for 3 days is probably not going to do it, but doing this in the context of a well experienced therapist could be. This is fascinating. Thank you. Thank you for this conversation.
Mm.
All right, we'll sign out and let you to your evening. Thank you so much for the
Thanks for having
conversation.
me.
Yeah, have a great week, everybody. Bye. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.